Hi everybody, this is Dr. Ihab Abdurrahman, Ihab Tarawa, Consultant of Acute Care Medicine at Soba University Hospital, Professor of Medicine, University of Khartoum. This course is based on basic emergency care course designed by experts from WHO. It is mainly to standardize the approach for acutely ill or critically ill patients. In this session, we are going to discuss ABCDE and sample history approach. The objectives of this session explain why to use ABCDE approach, discuss safety issues before approaching an acutely ill patient. Your safety is very important. Before you help someone else, make sure you are safe. Then describe how to assess and manage ABCDE component, mainly airway, breathing, circulation, disability, and exposure. Why ABCDE approach? The goal by implementing this approach, ABCDE, to identify life-threatening conditions rapidly, to identify them and to fix them. So we would like to ensure that airway is patent, is open, and there is adequate ventilation, air is moving in and out, and at the same time to make sure circulation is adequate. The adequacy of the ventilation, breathing, and circulation mean that there is adequate oxygen delivery to all organs of the body. So the approach with the ABCD approach is a systematic approach. We approach every patient the same way. Airway first, breathing then circulation, then disability, then exposure. We would like to recognize life-threatening condition early, and we would like to fix them. We do most critical intervention first. Fix the problem before you move, and if there is a problem in airway, fix it before you move to breathing. If there is problem in breathing, fix it before you move to circulation, and so on. ABCDE approach is a very quick, it can be done quickly in stable patient in very few minutes. What is sample history? Sample history is an structured approach for gathering information. The goal to rapidly gather history critical to the management of acutely ill patient. Immediately after we assess and fix airway, breathing, circulation, disability, and we do the exposure, we go for sample history. It allows us as healthcare provider to gather important and critical information. In sample history, S for sign and symptom, because this can direct us to specific disease and conditions. A for allergies, because the patient condition could be secondary to allergic reaction, and at the same time presence of allergy, it can allow us to avoid certain medication. In addition, we would like to know patient medication, because the existing medication can contribute to the current illness, or it need to adjust of new medication we are going to prescribe. Presence of the past medical history is very important. For example, a diabetic patient could be prone to hypoglycemia or hyperglycemia and diabetic ketoacidosis. At the same time, diabetes could be a risk factor for coronary artery disease, myocardial infarction, stroke, and renal disease. You want to make sure last oral intake, when was that? Because sometimes you need to do intervention, or you need to keep the patient fasting for certain illness, and you need to know events surrounding the current illness. If this is trauma, is this an environmental disaster, is it due to exposure to certain toxin? So you do the ABCDE approach. After you stabilize the critical issues, then quickly you do sample history, sign and symptom, allergies, medication, past medical history, last oral intake, and events surrounding the current illness. Before you approach an acutely or critically ill patient, make sure you preserve your safety. If you are part of emergency medical team or you go with ambulance for people in certain situation, you have to assess, like when there is a collapsing building, when there is fire, certain people with certain protective clothes they go in. During mass casualty, you need to assess the risk, situation awareness, and you need to call for help, and you need to have the skills to utilize those who are there at the scene. When there is violence and there is shooting, you have to make sure your safety and the safety of other team member and also the population safety. The risk of chemical spill or exposure should be assessed, and when there is a gas also it need certain protective equipment, and during infection and epidemic certain personal protective equipment should be utilized. Patient safety and your safety are very crucial, and standard precaution and personal protective equipment should be utilized. Before approaching any patient, hand hygiene should be done, and whenever appropriate you use the specific personal protective equipment. Depend on the situation when to use clean gloves, sterile gloves, gown, mask, goggles. This will depend on the situation. Detailed discussion will be in a different session. To summarize safety consideration, always assess scene safety if there is any hazard, violence, or any infectious disease concern. Whenever you're approaching a patient, make sure you do hand hygiene before and after, and you assess for the appropriate personal protective equipment. When there is chemical exposure, you need to utilize decontamination protocol. When you have multiple patients, you need to ask for help, and also you need to do detailed assessment if you can manage the patient in your facility or you have to transfer to higher level of care. And also when there is outbreak or exposure to different hazardous condition, whom to call and how to. Take home, ABCDE approach is an effective structured approach to assess and manage acutely ill patient by assessing and managing airway, breathing, circulation, disability, and exposure. Sample history, symptom and sign, allergy, medication, past medical history, last oral intake, and event. Sample history is an excellent tool for gathering information following stabilization of ABCDE. Thank you and see you in the next session.